Colorado declares a hospital crisis, allowing the National Guard, volunteers, even patients' families to help overwhelmed hospitals during this COVID surge. The governor holds fast against business restrictions and mask mandates, basically saying this new wave of COVID is hitting unvaccinated people who opted in for it. 4 school districts canceling class or going remote later this week. They can't find staff to keep schools open. Denver has a magic mushrooms committee, and now that they're decriminalized, the committee wants to make sure police don't actually shoot people who are tripping. We live in interesting times. Good thing we can meet here to talk about it on Next. Colorado is now America's COVID hotspot. It's become our 4th leading cause of death this year. And the state's new hospital crisis order out today means that the National Guard can now come in to help. Bottom line is you don't want to need a hospital in Colorado for any reason right now. I mean, go if it's an emergency for sure, but know that 93% of ICU beds are full. Patients can be involuntarily transferred anywhere in the state. And the crisis order from the state today acknowledges that hospital care is going to be worse than usual. The goal is to, quote unquote, gracefully degrade medical care. Crisis standards of care is what it's technically called. It allows hospitals to postpone non-emergency procedures, gives them more leeway to shift their staff and have them work longer hours. The National Guard can come in to do non-medical care, like checking people in at the front door. Patients' family members and volunteers may be asked to help with feeding and bathing. And hospitals are also given legal protection from lawsuits if the quality of care suffers. This is what happens when the healthcare system is stretched to the breaking point. The state's declared all of Colorado a high-risk area, which means every adult is eligible for a vaccine booster, no matter which shot you got originally. So, as long as you're 6 months out from your original Pfizer or Moderna or 2 months out from a J&J shot, you've got the go-ahead for a booster. The state order says the vaccine providers aren't supposed to turn anybody away, but we know from your feedback that you may need to get a little creative when you input your information online to get an appointment, because some providers are just going by the federal rule. Right now, about 25 Coloradans with COVID are dying each day. It has become the 4th leading cause of death statewide this year. The state's still compiling numbers for 2021, but they gave us an early look at what they found. COVID is Colorado's 4th leading cause of death in 2021. Only cancer, heart disease, and unintentional injuries like overdoses and car crashes killed more Coloradans. That only includes cases where COVID was the underlying cause of death, not merely a contributor. The pandemic's history suggests the worst of this wave for Colorado is still ahead. First, cases will plateau, then hospitalizations, and lastly, deaths. Our cases climbed again today. Hospitalizations are at a record for this year and rising faster than they were last week. And it's primarily unvaccinated Coloradans. They're the minority statewide, but make up 79% of hospitalized patients. All that considered, do not expect an indoor mask mandate or business restrictions. We had those last time hospitalizations were this high in Colorado, but Democratic Governor Jared Polis said today, this time around, 62% of the population has chosen to protect themselves through vaccination. It sounds kind of brutal to put it this way, but the governor's position is basically that this wave of the pandemic is mostly hitting people who have opted in for it. And that's somewhat true unless you're a vaccinated person who needs health care for any other reason. Researchers at the University of Washington have modeled out a couple scenarios of where this goes from here for Colorado. Now remember, some of their past predictions have been spot on, some have been way off. Their Institute for Health Metrics and Evaluation projects our daily COVID deaths to exceed 35 a day by mid-December if nothing changes. That's the purple line. It'd be twice as bad if the variant spread twice as quickly. That's the red line. Green line models 95% mask wearing in public. Pretty unlikely without a mandate, but that model has deaths dropping to 3 a day by February. The UW models reflect what we see at vaccination clinics as well, that the Coloradans who want the vaccine already got it. Their modelers predict only a 1% increase in fully vaccinated Coloradans in the coming months. It's staffing shortages, not COVID, that's pushing more schools in the metro area to go to remote learning or straight up close later this week. Dr. Martin Luther King Jr. Early College could go remote as early as tomorrow. Remote for sure on Thursday and Friday, when Ames Elementary will also be remote. George Washington High School will go remote tomorrow through at least the end of the week and maybe all of next. Staff shortages have 3 other full school districts closing on Friday: Boulder Valley, Adams 12 5-star, and Adams 14. The middle of this COVID surge sure seems like a curious time to get rid of expanded outdoor dining. Denver just made its program permanent. Other cities, though, are telling restaurants to get off their lawns and sidewalks and other public places. Here's Steve Steger with that.
We had to spend a good chunk of change to get these outdoor platforms made.
During the worst of times, a few $1,000s worth of wood paid massive dividends for Peakview Brewing.
Those platforms are pretty much the only reason we survived COVID, just like the main pandemic.
Owner Sean Peters says when the weather got cold, fishing tents made it possible to still serve customers.
We put lanterns out there and people kind of got this camping vibe. And, in the Denver Tech Center, which is pretty fun.
The platforms were helping the brewery rebuild, too. After COVID restrictions eased, it created extra space. But last month, the brewery got a message Sean says caught him off guard.
We have to get rid of them by Monday last week, or they would start fining us.
Unlike Denver, which decided to make its outdoor patio program permanent, the city of Greenwood Village allowed its program to expire on October 31st.
What does it really hurt the city to have these extended patios? Denver's extended patios are on busy streets. Greenwood Village, it's in parking lots. And if parking's not an issue, which it never is, why couldn't we keep them?
We asked Greenwood Village why and got a short statement in response. The city says they haven't had any requests from businesses to keep the program going and that they'd monitor the COVID situation and, quote, take the appropriate action.
They gave us an opportunity to be like, why do we want these platforms, or why do we still need the extended patio? I easily would have gone to a city hall meeting and been like, look, these are the numbers.
Sean says he found someone to take the $1,000 in lumber off his hands, and now he's turned his focus to getting permits for an indoor taproom expansion, hoping the latest surge in the virus won't spell more trouble.
Now, if kind of COVID numbers on the rise, there's a lot of unknown.
For Next, I'm Steve Steger.
The City of Aurora's program expired at the end of last month. City spokesperson told us businesses can still ask for a case-by-case exception to extend their patio seating. A new survey of low-income Coloradans shows that hospitals are not doing what they should these days to help people save money on health care. A survey of more than 400 adults in our state found that a majority of them didn't know that hospitals need to provide discounts and financial assistance to low-income households. There's a nearly decade-old state law that was strengthened this past year to require hospitals screen patients to offer them cost-saving options. The survey comes today from Magellan Strategies and the Colorado Center on Law and Policy. They're trying to prove that hospitals can still thrive even if patients get less expensive bills.
I think that there's a lot of opportunity for hospitals to connect these patients to whether it's public coverage that they might be eligible for or hospital financial assistance that might be eligible for. That will benefit everybody involved. It'll benefit the patient. They'll get the assistance they need with their hospital bills. And it also help on the hospital side to increase reimbursement either through a public program or by giving people the time to manage their bills.
The new state law requires healthcare facilities proactively see if their uninsured patients are eligible for discounted care, but that doesn't take effect until next June. Denver's police watchdog has been a political appointee of each mayor. Until tonight, city voters gave a 9-person panel the power to hire and fire the city's independent monitor. That's a person who reviews complaints against law enforcement, looks at incidents where officers use force and such. The Citizen Oversight Board is meeting for the first time tonight. Keep an eye out for anything that suggests that they're going to change the way that Denver keeps track of law enforcement.
The vision in Aurora is more than a clinic. It's about healthier futures.
We really want to create a space where they can come and access health care and wealth-creating opportunities in their community that they have lived in for years.
A community hub for neighbors, by neighbors. Denver voters decriminalized psychedelic mushrooms, creating protections for the people who use them. That has turned out to be a real trip. Next.
Undeveloped land is at a premium in the metro area. There are 27 acres of it in northeast Aurora, and there's a vision for health clinics, stores, restaurants, childcare facilities. Before developing that property, neighborhood advocates are making sure that it's what the community really wants there. Here's Victoria De Leon.
It's long overdue for people to for us to have input over what we want in our communities.
Change starts with the people who want to see it.
Yes.
That's why Shalila Dillard
You need to be a part of this.
is in Aurora doing this.
So you guys had no idea that there was going to be something over here.
I had no idea. I thought that this was just a big ass open space.
She spent the morning learning about the developments people want to see in their community.
I want to definitely see restaurants. We were talking about like there's not access to like Whole Foods or Sprouts over here. You have to go all the way to Denver.
I mean, yeah, because there's a lot of room in this field, so if anything.
Yeah.
Where most see empty land.
So when we look out at the site right now, right, we see a lot of prairie dogs living their best lives.
Diane Miles is working with Shalila to develop the Aurora Community Health Commons at the corner of Colfax and Airport Boulevard.
We really want to create a space where they can come and access health care and wealth creating opportunities in their community that they have lived in for years. So I envision housing that is owned by the community members. I envision like wealth creating opportunities, grocery stores, an ecosystem.
They want to help bring services that people like Isaiah Wing will directly benefit from.
Childcare, stores, restaurants, just whatever, stuff that we could use, really.
This is how it should be done. There should never be a time where developers come in and tell the community what they want. The community can generate wealth within itself.
Shalila and Diane want more people involved in the changes to come in the community they also call home.
Well, I'm glad you came out just to check in on your community, make sure everything is everything.
And so the people who live and work in these communities are the biggest driving forces behind this project, but it is also a partnership with CU Anschutz and Salud Family Health. So as far as timelines go, they want to start drawing out plans in 2022 after they've had some time to hear from as many people as possible in the Aurora neighborhoods. And if you live there, they want to hear from you. There's a survey out there that they want people to fill out by November 15th. And Kyle, that link's going to be up on our website.
They want to hear from people in that neighborhood as opposed to people who might want to move in. I think so often, Victoria, when we talk about development, there's a connotation that gentrification is happening, that the people who live in the immediate neighborhood, that their needs are not being met. It's for somebody else.
Yep. And what was great about today was I had the chance to actually speak to people who live there, people who didn't know about these plans, and they were very excited about the potential for childcare, for a park for their kids to play in, because right now there's nowhere for their kids to play. But they did bring up that question, is my rent going to go up? And so those are the concerns that these people want to hear about. And there's monthly meetings to address those concerns and how to make this, a development where it's not going to be pushing people out.
Yeah, and then hopefully some developer can come in and make some nice money and build something that people like and everybody leaves happy.
Yep.
How about that? All right, Victoria, thank you.
Training police how to deal with a city where suddenly psychedelic mushrooms aren't a crime anymore. It's going to take some planning to keep everybody safe. And it's a sign that everything's nicer in Aspen. Next.
Denver voters were cool with decriminalizing psychedelic mushrooms a few years back, and now the advocates who put that on the ballot are looking to expand the protections. 2019 voter initiative decriminalized psilocybin mushroom possession for people over the age of 21. Essentially makes mushrooms the lowest priority for law enforcement. The psilocybin mushroom policy review panel asked city council members today to expand decriminalization to a few other things, like allowing people to give mushrooms to somebody else, say as a gift. Merry Christmas, here's some shrooms. Also allow people to use them in a group setting without fear of that being a crime. And perhaps most importantly, the group wants first responders trained on how to respond to a situation where somebody's having a bad reaction.
Crisis intervention response training typically does not include response to psychedelic or psilocybin crisis. The training program that we have initiated will provide law enforcement, including Denver Police Department and Denver Sheriff's Department, emergency medical services, and mental health co-responders with knowledge and information to close gaps in current training.
Panel also recommends the city look into how psilocybin use as therapy might be handy in improving mental health services.
Cloudy skies, but mild temperatures, mid to upper 50s along the Front Range. A storm crossing Colorado will bring a little bit of snow to the high country, but only isolated showers here in Denver. And you know what? We're seeing a winter weather and travel advisory out for the northern mountains. That's the best shot at seeing some accumulating snow to freshen up the snowpack for those of you that want to get up and do some snowboarding and some skiing. Cloudy skies tonight, cloudy tomorrow, isolated rain showers in Denver in the morning with the best shot at snow again up over the higher terrain. It is partly cloudy, our low just under 40 tonight. Tomorrow we'll get some sun, mid 50s. Heading into tomorrow evening, colder air comes in. The next wave means a 20% chance of snow showers Thursday night. Beautiful Friday and a warmer weekend coming up. Enjoy your evening.
May I make a recommendation? I want to point you to somebody else's work that I think is worth your time. NPR News has gotten a hold of inside tape showing how the National Rifle Association did damage control following the Columbine school shooting in 1999. Recordings of private meetings after the shooting showing that the organization considered striking a more sympathetic pose in public than it eventually did, while NRA leaders also admitted they were in quote-unquote deep excrement. More than 2 hours of secret recordings and NPR's write-up on it show how the organization considered putting together a fund for the victims of Columbine, but felt that that might be admitting some responsibility. If you'd like to read the article, we'll have a link on the next Facebook page. It is a sign of one fine-looking piece of asphalt. It's indicated on the sign. That plus your feedback next. It's a sign that a Rolls-Royce might pull out ahead of you, so keep your head on a swivel when you're driving. Dennis was hiking along Highway 82 going towards Independence Pass. He's walking through the North Star area of Aspen, where there are a lot of hidden driveways emerging from mega mansions. And some Aspenite wants people to know they got a fine-looking front drive. Either that or somebody else wanted to give him a compliment. Nice driveway. Either way, watch out for a nice car pulling out. If you see a sign that makes you look twice, email it to next@9news.com. Or use the hashtag HeyNext on Twitter. Got a note tonight from the husband of a healthcare worker reacting to Governor Jared Polis's continued aversion to any kind of, say, indoor mask mandate or business restrictions in light of Colorado's record COVID hospitalizations for the year and about 25 deaths a day. Jeff Wolf wrote in to say the governor's not wrong about the idea that this is primarily a burden on the unvaccinated. But Jeff wrote, however, the largest burden is being shouldered here by healthcare workers who did not opt out whatsoever. As the husband of one, I can tell you they're struggling, they're not okay, they need some leadership from the governor's mansion. Jeff said, tell their story. We invite you, if you are in healthcare these days and can help folks understand what's going on, share that perspective with us so that we can share it statewide. There's our email, there's how to get in touch with us on Twitter. We're looking for first-person perspectives who can put some reality to what a crisis standard of care really looks like when any Coloradan goes into the hospital needing any kind of medical care. We'll see you next time.